Fertility preservation is a term that we use to describe saving a woman's fertility for future use. When we talk about fertility preservation, we talk about different methods. Some of the more popular methods of fertility preservation are things like in vitro fertilization, where we take the eggs and take the sperm from a couple, create embryos, and then store those embryos for future use. That's definitely the most highly efficacious form of fertility preservation. However, not all patients are candidates for this. In order to create embryos, you have to have a sperm source or a partner with whom you want the embryos to be created. So fertility preservation, which is highly efficacious in the form of embryo formation and embryo freezing, is really great for married women or women with a serious partner or women who are willing to use donor sperm. For women who don't have a partner and who are unwilling to use donor sperm, we offer fertility preservation in the form of egg freezing. This is still a highly experimental procedure, but as the technology is getting more and more advanced, we've moved towards a different type of freezing the egg called vitrification. Egg vitrification is a novel, new technology where eggs are flash frozen to maintain them for future use. This is a really promising technology that we think is going to be utilized much more in the future, and the outcomes right now, although limited, are promising. What a woman would have to do to preserve her eggs is to undergo a stimulation cycle, usually with the use of the same drugs we use for IVF. We would then undergo an egg retrieval procedure to take the eggs out of the woman's ovary and then freeze them shortly after taking them out. In the future, when the woman had a sperm source, either a partner or selected a donor, the eggs would then be fertilized with that partner's sperm, and then embryos would be created and placed back into the woman's uterus when she was ready to conceive. Those are the two main methods of fertility preservation that we talk about.